I'm David Williams, president of the Health Business Group and author of the Health Business Blog. Welcome to the fourth episode of Health Business TV. Today I'm going to talk about concierge medicine, my recent premium hike for my health plan, provider engagement, HIPAA security and privacy, and driverless Uber cars. Well, I have mixed views about concierge medicine. I understand how physicians want to get off the treadmill that primary practice is today. Patients are now used to paying for things, including copays and deductibles and other services, so they're paying for concierge practice as well. But I do worry about what it does to capacity in the market. When a physician drops his or her patient panel from 3,000 down to 300, that dumps a lot of patients on other providers who may not have the room. On the other hand, maybe it will make primary care more attractive in ways that other sorts of inducements and encouragement has not. So we'll see what happens there. Now, I actually started to look into concierge physician for myself, and at least in Boston, it must be a pretty popular way of practicing. There's a lot of demand for it. I spoke to one practice that's full and not taking patients, even those willing to pay the $3,000 retainer. Two other practices that I contacted didn't even bother to return my emails. I also heard recently about some cash-only specialists, which is kind of a concierge model. That's long been prevalent in things like cosmetic surgery, dermatology, but I don't really like the idea of a cash-only specialist. I don't think it makes sense. Probably better to have a concierge primary care physician to do the coordination and interpret what the specialist is suggesting. So meanwhile, as I was thinking about spending up to $3,000 for concierge practice, in a way it's good that I didn't, because I got a rude awakening on the renewal from Blue Cross Blue Shield of Massachusetts for our small business health insurance. After 2 years of the premium not rising at all, we're hit with a 29.3% increase, which in our business amounts to $6,000 per year for family. I spoke to my account executive about that. She blamed Obamacare, but I wasn't terribly convinced. Basically, pediatric dental is now included. The rating is based on the size of the family and not just whether it's an individual versus a family. And there's some rules about what they can count and not count toward the deductible. Doesn't add up to 29% to me. I'm waiting to hear back from the senior communications folks at Blue Cross. I'm not sure why they haven't gotten back to me yet. We'll see. I have heard from other people that I know that they're also getting these increases in the 20+% range for small business and other organizations in Massachusetts. I'm surprised there hasn't been more of a story about it yet. On the blog, I also published an interview this week with Mike Coyne. He's CEO of Quantia, which is a provider engagement platform. They've focused in the past on pharmaceutical companies. The pharmaceutical companies have always understood the importance of reaching and influencing healthcare providers. More recently, hospitals and health systems have also started to catch on. Now that they're employing physicians, they're realizing that it's not enough just to be sending a paycheck to the employed doctor or nurse practitioner or other clinician, but they also need to find ways to really engage them. So Quantia has a new platform. I talked about that on the blog with their CEO, Mike Coyne. Also on the video front, I recorded a video a few months ago about clinical documentation and health business group research in that area that we've done for Nuance Communications. I really like the folks at Tech Target in Newton, Mass, where we recorded the video, and so I've kept in touch with them in order to do other healthcare-related videos. So today I served as an expert about privacy and security HIPAA provisions, and we produced 3 video segments with a technology company client that should be released reasonably soon. I'll let you know when that becomes available. Meanwhile, I also happen to see that my friend and former colleague, Mickey Tripathi, who's the CEO of the Massachusetts eHealth Collaborative, was quoted on the same topic in Fierce Health IT. And truth be known, he is more of an expert on this topic than I am. My last topic is really not healthcare related, but I've been thinking a lot about changes and innovations in transportation that's really affected things in Boston for the better. I'm a particular fan of Uber, which does a much better job in my town than the local taxi company. It's better, it's cheaper. Plus, we're starting to see driverless cars, not so many around here yet in Boston, but it's soon to come. And it got me thinking that if you combine Uber with a driverless car, there'll be no need for a driver, which will make Uber less expensive. There'll also be no need for parking. Now, I looked this up because I knew it wasn't an original idea. It turns out the CEO of Uber was talking about this just within the past several weeks. To me, it seems like in a few years you'll be able to have kids go and visit their grandparents or their cousins in far-off cities without anyone needing to drive them there. And it's going to change the family dynamics, reduce the need for mom or dad to drive the kids around to their activities, and also probably reduce highway congestion at the same time, since the driverless cars can stay closer to one another than those that are being driven around. So I think it's going to really revolutionize things over the next several years. So that's it for now. I hope you have a terrific weekend.